Welcome back, Physician Center for Beauty. Again, I am rejoined by my co-host today, and that is Dr. Sean McGuire. And Dr. McGuire, if anyone has any questions about any of the procedures that are offered here at the Physician Center for Beauty, you're more than willing to take phone calls and answer questions.
Yeah, absolutely. If there's any viewers that want to call in with questions, we can take them live on air.
All righty, 571-5263. If you'd like to call about the events or specials, then just call the Physician Center for Beauty. All right, let's talk a little bit about tummy tuck, abdominoplasty. Tummy tuck a little bit more catchy.
Yeah, abdominoplasty.
Oh, I said it wrong.
Yeah.
Abdominoplasty, not abdominio.
Yeah. Abdomen, obviously, and plasty. You know, which brings up an interesting point. People ask all the time why our specialty is called plastic surgery. Actually, the specialty is plastic and reconstructive surgery, and it's not because we use plastic or anything like that. But it comes from the Greek word plastikos, which means to shape or to mold. So, little known fact.
Educational show today.
Yeah. So that's what we do. And we do surgery basically to shape and to mold things, whether it's reconstructive or the cosmetic surgery that we do. And specifically today, we're going to be talking about abdominoplasty, and we've got some pictures to show before and after. It's a procedure that's done in an operating room. It is an outpatient procedure, so most people can go home afterwards. And there's some downtime with it, typically 2 or 3 weeks, depending on the person's profession and what they do for a living and kind of their normal activities. Some examples that we can see here of typical, post-pregnancy kind of weight gain and excess skin and kind of looseness there. We not only are removing loose and excess skin in this surgery, we're also tightening the muscles. So the abs muscles typically have spread apart after childbirth or with weight gain, weight loss, and weight gain again. We're seeing these muscles that have spread apart, and so we repair that separation of the muscles in this surgery. That's typical. Most of these results are kind of typical from my practice.
Unbelievable.
So it can make a big difference. Many of these photos show the after photo at around 3 months, which is a little bit early because the scars haven't faded completely. So the scar can be fairly long, but it does fade with time and looks better over time. But it can take 6 months to a year for a scar to look its best.
Well, interesting. Now, and sometimes people think, well, maybe it's due to childbirth. Perhaps it's weight gain. Maybe someone has had some kind of other type of surgery as far as the band surgery that they have, and they've lost a lot of weight.
Right.
All of these can be true, but also can just be genetic, right?
Yeah, and certainly that's true. But we are seeing a real uptick in this type of surgery because of the increase in weight loss surgery. So like the lap band procedure that you mentioned and gastric bypass, and there are several other procedures that are being done. And that's become more and more common. And as patients are losing large amounts of weight, sometimes upwards of 100 pounds or even more, they're left with a lot of loose skin, a lot of excess skin. And so we're seeing an increase in the surgery that I do, the cosmetic side of things, as people are losing a substantial amount of weight.
Wow, these pictures, before and after pictures, are absolutely amazing. How is this different? How is the surgery different? You as a plastic surgeon, how has this evolved? I know everything medically evolves, but how are tummy tucks different than, let's say, 10, 15 years ago, Doc?
Yeah, so the techniques have evolved, specifically how the surgery is done. We've made some improvements there. One of the neat things that's new in my practice, and it's I'm among the first in the state, in fact, to use this procedure, where we're able to do, oftentimes, not always, a tummy tuck without the use of a drain. So typically a tummy tuck is done, there's a large surface area that we've sort of worked on that can produce some fluid. So we put a drain in, and the drain is left in place sometimes for a week or more. And it's necessary, but it's kind of a hassle.
Sure.
And so if we can do this kind of surgery without a drain, that's a huge advantage. So this new technology, it's actually a tissue glue is used to kind of seal everything off internally so that there's not that fluid buildup, and a drain is oftentimes not necessary. So that's a huge advantage. It helps with recovery and it minimizes pain afterwards, and it's just an easier recovery for the patient if we can do it without a drain. Can't do it in every case. I did one yesterday without a drain. We used tissue glue, and it worked very well, and it does speed the process of healing and recovery quite a bit.
You and I have talked about rhinoplasty here, you like having your nose done, but there's some artistry involved here as well, isn't there? I mean, this isn't something like, okay, I'm just going to remove some fat and we're done. It's a lot more than that, right?
I think so, yeah, for sure. We want to contour the body proportionally. We want to restore the waistline. We want to remove the right amount of excess skin, not too much skin. We don't want to leave excess skin. So it's body contouring surgery, as we call it. So it is an art, certainly.
All right, and what kind of downtime are we talking here again, Doc, for someone who'd be interested?
Yeah, for a full abdominoplasty, a full tummy tuck, there are smaller operations, but typically you're looking at 2 or 3 weeks before someone's ready to go back to their full-time work, depending on what they do. They're able to walk around, and they can certainly do some walking in the neighborhood and do some basic things around the house within that first week. But it takes a while. They're fairly sore, and actually the soreness oftentimes is from the muscle tightening that we've done. So it feels like they've done a bunch of sit-ups. So the skin itself and the incision is not necessarily terribly painful, but it's that muscle soreness that can take a while to resolve.
All right. Makes perfect sense. If you're interested in a tummy tuck, give them a call, or some of the specials and events that are taking place here at the Physician Center for Beauty that you've seen, give them a call. Once again, we're Wave 3 Listens. Have a wonderful day. Stay dry, and we'll see you tomorrow on Wave 3 Listens Live.